Hi everyone, I'm Andrea. I am a ultrasound technologist. I currently work in Lethbridge at Radiology Associates. I've been scanning for almost 13 years now, and the first 10 years of my career I worked in Calgary at Foothills Hospital and was an integral part of the MFM antepartum unit. So upon moving to Lethbridge, I've been here at Radiology Associates for about 3.5 years. We have been communicating with Calgary and have been trying out telemedicine. So essentially what that is our clinic does a ton of OB, lots of routine details. And essentially what telemedicine is once we scan a patient, if there is an abnormality, they get sent to MFM in Calgary, which always still happens. And they have the genetics and other full anatomical scan, they have the counselors, they have everything they need. But once they have that whole workup done with Calgary, is there a reason for them to have all their subsequent scans done in Calgary? So we are trying to alleviate some of the stress, some of the driving for these moms that are before having to drive to Calgary, sometimes weekly, sometimes bi-weekly. So I just wanted to kind of give everybody a brief overview of what we're doing and trying out, and we've been kind of piloting this program for about almost a year now. So what we do is when we receive the patients back, we have access to our scan, the scans they had in Calgary. We book patients in a typical MFM day for us. So we usually have 2 sonographers scanning 3 to 4 high-risk cases. And the perinatologists from Calgary know the patients that we're going to scan, and we contact them usually through text. We get a full idea of what they expect of us in the scan, and kind of before we start, we communicate with them that we're going to be starting and what exactly they want. We go in, we do the full scan. The patient's aware it will take a little longer because after the scan's complete, we push all of our images to Calgary, and whatever Peri's on, they are aware that these images are coming. They review the images with us, and then they communicate to us, the technologist, if there's anything else they need. If they do, we do go back in and get a couple more images or Dopplers or whatever else is needed. And so that's sometimes where a lot of patients has to come in because it does take time to get the images to Calgary to potentially go back in and take more images until everybody's happy. So really it's a great program for the patients, and that is the goal, is to increase patient care. These patients are so happy to sometimes be cutting down on 4.5, 5 hours of driving a day per week, sometimes bi-weekly. And then after we've completed the scan, our radiologist working in Lethbridge also can communicate with the perinatologist to make sure the reports are kind of on par and everybody's on the same page with what's happening with the patient and that they're happy with the images. And then what's awesome for the patient is later that day, based on their appointment time, they have a follow-up Zoom consult with a perinatologist in Calgary. So it's been working really well. Patients are very happy with the service. A lot of patients, either they just don't want to drive every week or every other week if it's unnecessary. They're still getting the same quality of care. And then of course, if we do the scan and we see anything alarming, they know, like if your Dopplers are really bad or the growth has fallen off and something's wrong with baby, that they will then have to go to Calgary. So we're pretty much a rural site, kind of trying to be somewhat of a middleman to help improve patient care. So far it's been working really well. We have 3 or 4 technologists now in Lethbridge that have done extra training for MFM and increasing their skills. We're all learning still and working out some kinks, but overall it's been really awesome, and the communication between our rads and the peris and our techs and some techs in MFM just really help improve the patient's quality of care and make us better techs. So we hope to keep growing, and the telemedicine program potentially extending to other rural sites in the future.